We're talking about something that affects many urban women. And, unfortunately, we cannot really avoid this. It's part and parcel of, I think, going along on the timeline as we get older. So what are we talking about? Well, menopause. It is actually widely associated, with symptoms like hot flushes, night sweats, mood changes. But for many women, there's another concern that can just feel as distressing, and that is noticing hair thinning and hair loss. And recent research suggests that more than half of postmenopausal women experience some degree of female pattern hair loss. Well, despite this, it is still frequently under-discussed in consultations and often not fully investigated. So to talk to us about this, we're talking about hair loss after menopause. We are joined now on the line by Dr. Kashmal Kalan, who is Medical Director at Alvi Armani South Africa. Good morning, Doctor. Welcome to Urban Women on Radio Al-Ansar.
Good morning, Razia, and thank you for having me on your show today.
It's an absolute pleasure. Thank you so much for your time. Now, to begin with, Doctor, share with us, why is hair loss during menopause still such an under-discussed issue, even though research shows it affects more than half of postmenopausal women?
No, Razia, that's an absolutely great question, and I think that there are two main reasons for this. Firstly, we tend to associate menopause with symptoms like hot flushes and mood changes, things that are very commonly spoken about. So hair loss often gets overshadowed. Secondly, many women feel embarrassed to talk about it because hair is so closely linked to identity, femininity, and confidence. So it has a twofold approach. One, females are generally not open to discussing the problems when it comes to their hair. Yeah. And secondly, clinicians alike often overlook the problem as being more aesthetic rather than a medical issue.
True.
The reality is that more than half of women will notice some degree of hair thinning after menopause. It's incredibly common, but that doesn't mean women should simply accept it. Right. I always say hair loss can have a profound emotional impact, and it's something we as healthcare professionals should be discussing much more deeply and openly. And I almost want to say that when women are generally going to their gynecologists or their endocrinologists or even their general practitioners for menopausal conditions, hair loss should be an openly discussed symptom, and these patients should be directed to the right specialist so that we can holistically treat the patient rather than just focusing on one or two of the symptoms.
So important. I mean, women do think it's just aesthetics, and we can overlook it, and we can be a little bit shy to talk about these kind of things because we need to come up as if we are so perfect. Isn't that right, doctor?
No. And when that's exactly the point.
That's it. And
everyone wants to be brave, but suffer in silence, which is something that shouldn't happen anymore.
That's true. Just put on the filters and let's act like we're all good. Behind the scenes, we know what we're dealing with. But it's so important that we actually, address the root causes of things. And I think, Doc, many women actually assume that hair loss is just a normal part of aging. And at what point would you say does it move from normal change to a medical condition that actually needs investigation?
So let's say it's true. Some reduction in hair density is a normal part of the aging process, but persistent or more noticeable thinning definitely deserves attention. So if you're seeing more hair in the shower, your ponytail feels significantly thinner, your parting in the center or the side is starting to widen, or your scalp is becoming more visible over, several months or years, it's worth having it assessed. I always tell patients, hair follicles are living structures, and the earlier we identify what's driving the problem, the better the chances of slowing or even reversing some of the loss can be. So I think this takes us back to the first point again. You as a woman would know better than anyone else what your level of hair is. And you would be the one that's more concerned if you're seeing more hair in the shower, if you're seeing more hair throughout the house, or if anyone else is complaining that there's just a lot more hair loss happening. So at that particular point, when we're moving away from just the normal age-related changes to something that seems a little bit more significant, that would be the ideal time to start seeking some medical investigation so that we can get on top of the problem earlier rather than later.
Absolutely. So pay attention to your body and just live, as we say, live in consciousness all the time. Now, Doc, hair loss isn't only hormonal. What are some of the less obvious underlying causes that doctors should be screening for in menopausal women?
Yeah, so Razia, hormones certainly play a major role, but they're only one piece of the puzzle, if I can put it in that way.
Mm-hmm.
I always encourage a comprehensive assessment because, mineral and vitamin deficiencies such as iron, vitamin D, zinc, all of these mineral deficiencies can give rise to hair loss in itself.
Mm-hmm.
Then we look at other medical conditions such as thyroid disease, low protein intake, zinc deficiencies, and a very common problem that we talk about, which is stress.
Yes.
All of these problems can compound the hair loss that we're currently experiencing. I think one very key area that we're seeing a lot of women struggle with right now is the rapid weight loss that they've been experiencing with, the GLP-1s and things of that sort that is resulting in, rapid weight loss.
Oh, yes.
That rapid weight loss in itself creates an unstable metabolic state, and that in itself will cause hair loss as well. So in many women, it's actually a combination of factors rather than one single cause. And that's why a detailed history and appropriate blood tests are often just as important as examining the scalp.
I mean, you touched on something so important that we're seeing the new trend of this GLP-1 products, and lots of women are on it. So there we go. Some of the side effects now. Pay attention to what's going on with your hair as well. Doc, we know that female hair loss actually differs from male pattern baldness. So what mistakes are sometimes made when treatments designed for men are applied to women?
Exactly that. So one of the biggest mistakes is assuming that what works for men should automatically be the same for women.
Mm-hmm.
Female hair loss is biologically different. Women usually experience diffuse thinning across the scalp rather than having complete bald patches that males would experience. And hormonal considerations are very different between males and females. Treatments need to always be individualized. You need to take into account menopausal status, underlying medical conditions, family history, as well as future health considerations. So simply copying a male treatment plan often overlooks the real cause of the problem. And I think the beauty of the hair industry now is because hair loss is becoming something that's more open, people are discussing it more, it becomes less stigmatized to actually have treatments done.
Mm-hmm.
There's been a lot more work done on female hair loss, and we can now bespoke our investigations and treatments for females rather than just taking what was done in the past on males and copying it over to our female population.
Fantastic. I mean, we are so wired, biologically so different. So obviously the treatment also should be different. So thank you for explaining that so nicely. And would you say is there anything women can actually realistically do with terms of lifestyle, nutrition, early care to just slow down the process once they actually start noticing changes?
Absolutely, Razia. And I think this is a very, very important question. I think the first and foremost step is not to ignore it. Early intervention generally produces the best outcomes. So the earlier we can get on top of the problem, the better the overall, not just result, but the overall process will be.
Right.
From a lifestyle perspective, ensuring adequate protein intake, correcting nutritional deficiencies such as iron or vitamin D when present, managing chronic stress, getting good quality sleep, and importantly, avoiding harsh chemicals or heat damage will all support healthy hair.
Mm-hmm.
But it's also equally important to understand that lifestyle alone may not be enough.
Right.
So if there are underlying medical or hormonal causes, this must be investigated, and it must be investigated properly. That's why I always say seeking professional advice early can make a significant difference before the hair follicles become permanently damaged or permanently weakened, whereby a hair transplant, for example, may be the only outcome or potential outcome for a result. So I think as a key take home from that entire synopsis would be early intervention wins the day. Please do not ignore it. If you are finding that your hair caliber, density, health is changing, seek appropriate medical care and professional advice so that we can win the battle together early rather than later.
Early intervention wins the day. I love that, and you also started off by saying, don't ignore it. So it's almost like ignorance, as I always say, ignorance isn't bliss. It doesn't help us in any way. And of course, if you know where the deficiency is coming, what you can do in order to help yourself, then why not get the relevant treatment sooner rather than later? Dr. Kashmal, it's been absolutely wonderful having you, an urban woman, this morning. We thank you for your time. Thank you so much for your time and for those words as well, Doctor. Until we connect again, we wish you a lovely day further. Bye for now.
Thank you so much and take care. Bye.